Hello, I am Youngjae Kim, Director of Korea Dental Hospital. Today, I will explain the basic surgical kit for the SLOCK implant system. When performing implant surgery, the implant itself is important, but the instruments used to place the implant are equally important. Therefore, I will explain the components of the basic kit and how to use them in detail. First, I will introduce the components of the basic surgical kit. Starting with the drill arrangement, the drills in the SLOCK implant basic surgical kit have a fixed length of 15 mm. The spiral drills are arranged from left to right in order of increasing diameter. Directly below them are countersink drills, allowing the step-down technique to be used conveniently. The upper row contains 15 mm depth drills arranged in order of diameter, with countersink drills located directly below them. By removing the cortical bone first, and then performing depth drilling, osteotomy can be performed in the correct position and direction while minimizing bone heating. Above them are stoppers for the depth drills, allowing osteotomy to be performed to an exact depth up to the 3 mm diameter drill. Above the drills are a start drill, a drill extension, and a side cutting drill to assist the osteotomy. Next, at the top is the direction indicator. The direction indicator is also called a direction pin or a depth gauge. To the right of the stopper is the fixture driver used for fixture placement. To the right of the fixture driver is the screwdriver. Once you understand this drill arrangement sequence, you can easily and quickly place implants in the correct position and direction. Next, I will explain how to use the basic kit. First, let us look at the start drill. Generally, many companies provide point drills, lance drills, and side cut drills, but this basic surgical kit integrates those functions into the start drill. The start drill can be used to determine the osteotomy position and also has a side cutting function. When placing an implant, the start drill is very useful for determining and adjusting the osteotomy position. If you need to modify the start drilling position more easily, you can use the side cutting drill. The side cutting drill can be inserted into the osteotomy site to modify its shape. In particular, the side cutting drill is more useful when preparing implant sites in the mandibular anterior region. After determining the osteotomy position with the start drill, the osteotomy depth is created using a 3.0 mm spiral drill. Then, after performing crestal osteotomy with a 3.7 mm side cutting drill, implant site preparation can be completed with a 3.5 mm spiral drill. The spiral drills increase in diameter from left to right, ranging from 2.3 mm to 5.7 mm. These spiral drills have excellent cutting efficiency and allow stable osteotomy. These drills you will be able to perform drilling easily even in dense bone. The countersink drill is used when the cortical bone of the crestal ridge is dense and thick. After initial bone drilling, if the available bone is determined to have high density, step-down osteotomy should be performed. For example, after performing initial drilling up to a diameter of 3 mm with the correct position, direction, and depth, the crestal ridge bone is first removed with a countersink drill, followed by deeper osteotomy. In other words, by removing the dense crestal ridge first and then drilling deeper with a spiral drill, the position and direction of the osteotomy will not change during drilling. In most osteotomy procedures, drilling tends to deviate from dense bone toward less dense bone, so step-down osteotomy should be performed to prepare the implant site in the correct position and direction. Another advantage of step-down osteotomy is that it reduces the possibility of bone heating and prevents necrosis of bone tissue. Saline irrigation for drill cooling can easily reach the already removed crestal ridge area, reducing the possibility of bone damage. This drill extension can be attached when adjacent teeth interfere with osteotomy or fixture placement, increasing the overall length and making the procedure easier. In actual clinical practice, implant placement in the anterior region often involves the issue of narrow spacing between adjacent teeth. Therefore, a drill extension is a very effective solution for working within narrow interdental spaces. In particular, the drill extension of the SLOCK implant, which has strong rotational resistance, is useful for anterior implant placement. When osteotomy is performed using a drill extension, the correct drilling direction can also be easily confirmed. In addition, Accessibility and visibility are improved during drilling, allowing implant site preparation to be performed in the correct position and direction. This is the engine-type fixture driver. It can be connected to a contra angle and used for implant placement. If adjacent teeth interfere with fixture placement, attaching this extension increases the length so it can be connected to a torque wrench. Below is the fixture driver for the torque wrench. The ratchet-type fixture driver can also be connected to the torque wrench for implant placement. Next, let us look beside the fixture driver. There is a 1.75 mm torque screwdriver. Both handpiece and ratchet drivers are provided in short and long versions. With the 1.75 mm torque size, it has a strong structure that does not deform even at up to 100 cm. This is very convenient. When manipulating the driver inside the oral cavity, it allows stable screw picking and can withstand the tightening force applied to the fixture. The connection portion used to tighten the implant screw must be deep. If this connection area is shallow, slipping can occur easily, and it becomes difficult to connect the screwdriver precisely, so it should be designed deep for safe and easy screw picking. The torque screwdriver of the SLOCK implant was designed to make this process easier. Next, let us look at the direction indicator. There are two types of direction pins, a long one and a short one, and there is one unique feature. The short direction pin has a length of 6 mm and can be used to confirm the minimum depth after initial osteotomy. In other words, after performing initial drilling of about 6 mm, inserting the 6 mm direction pin and taking a radiograph allows accurate confirmation of the osteotomy depth. This is especially useful for confirming a safe drilling depth in the mandibular posterior region with limited available bone. It allows accurate measurement of the minimum osteotomy depth needed to avoid injury to the mandibular nerve canal. Although this is a simple process, it is extremely useful in actual clinical practice. While practicing clinically, I often thought it would be great to have something like this, so I finally included it in this kit. The most important step in implant treatment is fixture placement. The fixture must be placed at the correct position, direction, and appropriate depth. Therefore, confirming the position, direction, and depth of the initial osteotomy using a direction pin is a very important step. The SLOCK implant provides a healing plug by default, which allows easy confirmation of the fixture placement position and direction. In other words, the direction pin is used to determine the osteotomy position, direction, and depth when preparing the implant site. Then the healing plug is used to confirm the position, direction, and depth of the placed fixture. The healing plug is extremely important. The healing plug is truly an indicator of implant position and path. It is especially necessary when placing multiple implants to ensure the correct position and direction. When placing the fixture, having the patient occlude allows easy confirmation of the relative positional relationship with opposing teeth or implants. The same applies to single implant placement. For example, when placing an implant in the mandibular second molar region, even a slight error in path may lead to mechanical complications later, so the healing plug must be inserted into the fixture to confirm these factors. The healing plug of the SLOCK implant has a simple design. The most important point is the area with two bands shown here. These markings indicate 1 mm at the lower part and 2 mm at the upper part from the top of the fixture. Recently, when placing implants, at least 1 mm of subcrestal placement is recommended. From the perspective of soft tissue, a depth of about 4 to 5 mm is recommended, and the boundary with the top of the healing plug can serve as the reference line. It is very simple and clearly distinguishable, and if necessary, the fixture placement depth can be adjusted. This component is particularly useful when placing fixtures using the flapless technique. So far, we have reviewed the basic kit of the SLOCK implant. Although there are many tools used for implant placement, the SLOCK implant basic kit contains only the essential ones. I am confident that it will help you perform implant surgery more conveniently. I hope this kit will help you perform implant surgery comfortably and easily. Thank you.